I'm Dr. Suneela Garg, working as Head of Department of Community Medicine at Maulana Azad Medical College. I'm also advisor to Department of Biotechnology and Indian Council of Medical Research on the issues of public health importance. Also, as a public health manager, my role is to provide guidance and inputs in the policies and programs which influence our country in a major manner. If you are looking at the issues, basically which are of importance in rural and urban areas, primarily if you take from the very basic issues like water, electricity, sanitation, and which is one of the core areas under Swachh Bharat Abhiyan, all these issues, they influence both our rural and urban areas in a very big manner. And simultaneously now we have to focus on a very big chunk, that is the population of adolescents, that is between 10 to 20 years, which are forming a major chunk, that is 20% of our population. And we need to educate them about not only how to lead their lives, but how to lead a responsible life. Because these are the formative years when you see we can educate them and they are impressionable minds. And we not only have to tell them about the importance of balanced diet, nutrition, but also we need to tell them about drug abuse, we need to talk to them about smoking, and we need to talk to them about the normal physiological issues about growth and development. Now to take an example, like suppose a girl who is attaining the age of 11 or 12 years of age, she should know exactly what is the process of growth and development, and she should not be unnecessarily worried about. And at the same time, we are going to empower her that she should be able to say no to any unwanted situation. Similarly, we should not ignore our young boys who are also in the active process of growth and development, and we need to teach them about all the values of life, how to lead life, have responsible behaviors. At the same time, they should be able to make mature and responsible decisions. So the major core issue at that time would be that we need to tell them that at one time for girls, when we say that you must be empowered to say no, but we need to tell our own young boys as well that all these actions, unwanted actions or irresponsible behaviors are liable to be punishable, under the legal act of the government. So that is where we need to create awareness. But I will say the society has to change as a whole, and we need to have dialogue right from the grassroots people to the higher level. So that means if we are looking at a rural situation, we need to have a dialogue with our important key decision makers, including our Panchayati Raj institutions, which are going to influence in a big way. And they have already been envisaged to be roped in under National Health Mission program of the government. At the same time, in the urban areas where there is a lot of immigration which is taking place, and we do get populations from neighboring states, and particularly in metropolis, which is facing a major problem, we need to look at that how we are going to address. And there has got to be channels, and already there are channels from the formal system also how to reach out to urban areas. But then the major problem, which is in the form of slum and all that, we need to have our balanced approach in creating awareness towards the sensitive issues of growth and development, towards the available policies which are there with the government. And overall, I'll say that we need to follow a holistic approach from womb to tomb. That means we need to have a safe child, we need to have a very empowered youth, we need to have an empowered woman who can make decisions. We need to have a healthy elder. And that is where, and they should be well aware of all the policies, programs, be able to lead their own lives. And that is where we as individuals and we as intellectuals can make a change and bring a difference to the society.